What we're treating in here is actually the knee capsule. Over time, the knee capsule can actually get stuck to the meniscus and the tendons in here. When this does, it actually causes pain and decreased range of motion in the knee. When that happens, it can put more wear and tear on the cartilage and the surrounding structures. What we're able to do with the instrument is get in there and actually gradually chip away at that adhesion. As we do that, that restores normal blood flow and oxygen back to the capsule and into the knee itself. A lot of times the capsule is one of the main culprits in knee problems that gets misdiagnosed and not figured out by a doctor properly. Luckily, adhesion is completely reversible in the knee capsule with expert treatment.